All right, good afternoon, everybody. Thank you for coming to our COVID-19 local response press briefing. I would like to announce today that this will be our final press briefing unless anything particularly crazy happens in the next few weeks. Any further information that's needed for any COVID-19 related things, please reach out to the respective agency that it would be for. Not to put Lisa's name out there, but First District Health Unit would be most likely the first place to reach out to for any press releases, any interviews, anything of the like. But with that, today we have Lisa from First District Health speaking, Randy Schwann from Trinity Health, Mark Janser, the President of the Minot City Council, and myself on behalf of Ward County. First up, Lisa.
Thank you. Good afternoon. It's been a busy week in the world of responding to COVID, and I think it's also been a good week that you will hear about. So throughout the district, we have done, and just a reminder, when I talk about throughout the district, I'm talking about Bottineau, Burke, McHenry, McLean, Renville, Sheridan, and Ward counties. That is who First District serves. So throughout the district, in the 7 counties, to date, we have had 6,485 tests completed. 713 tests were conducted this past week. 268 tests were done in the rural communities. 4 new cases have been identified this past week, 2 in Renville and 2 in Ward County. Those were all classified as community transmission. Of the total of 57 positive cases so far in the First District, only 10 are still active cases right now. This past week, on Friday, we did 434 tests. We were targeting a risk population, which is the Minot PD and their fire department, some Ward County staff, Ward County Sheriff Department, and detention center staff, including juvenile detention. All inmates at Ward County Detention Center and juvenile detention were tested. Law enforcement from Burlington, Surrey, and 1 U.S. Marshal were tested. You could expect that most of your emergency responders who have been very vigilant on protecting themselves against COVID would not have a lot of positive cases. And that we are happy to report there were no positive cases in that grouping. The inmates live in a more higher risk environment. So the average time that the inmate spends at the Ward County detention is less than 2 weeks. So that is a pretty fluid clientele. And so the fact that no one test was positive of those 136 is very significant to us. So we were very, very pleased to see that. This tomorrow in Ward County in Minot, there will be a drive-through testing. Last week, I had announced that I thought that it would be 2 days because of lab capacity. It will be 1 day this week, and that will be tomorrow. Testing will start at noon and go till 4 or until all tests are utilized. We have 500 tests available. So we will be at the fairgrounds, and we are asking everybody to please come in on the gate or on the 4th Avenue gate. That is the gate that goes past Lowe's Garden Center And so you will come in just as you were coming in from the north side of the All Seasons Arena. Sometimes I'm directionally challenged, so I hope that. But Lowe's Garden Center, and we want you to come in from the west, if at all possible. If you can't, there will be officers there that will be directing traffic, and they will allow you to come in that way. We don't want to divert you all the way around, but we would encourage you just to have the flow going better to come in from the west. Anyone age 12 and up can be tested, and you don't need to be symptomatic. We are really encouraging what we call the essential workers, and the way to define that is those entities that were working in facilities such as grocery stores, gas stations, that were always open throughout all of this pandemic activity. Those would be people that we would like to see or really encourage to attend this. You can pre-register, and you can do that on fdhu.org. That's our website. I'll repeat that one more time, fdhu.org. If you pre-register, you may or may not receive confirmation, but even if you don't receive confirmation, you are still on the list. Once you have entered that data into that pre-registration, you're on the list. If you pre-register, you are not guaranteed a test, but it may get you through the lines faster. So it is not a prerequisite to coming. So if you don't pre-register, no worries, come. If you don't, there are no limitations to who can come and when you can come and how you can come. So we encourage people to come. It is on a first come, first serve. And just because you pre-register, you aren't guaranteed a test. It is first come, first serve. The purpose of pre-registration is just to get you through in a more efficient manner. You are not asked to stay home for 24 to 72 hours because you have taken a test. So that should not impact your decision on whether or not to be tested. You won't be asked to stay home. You will be asked, however, to continue to practice all the things that we have asked you to do. Social distance, mask when you're out in public, use good hygiene, and so forth. So we would encourage you to do that. The results from the tests will be available between 24 and 72 hours. All people that are tested will receive a call. The call may not be from a number that you recognize, so please answer your phone because we'll be calling back 500 test results here. So answer your phone, even if you don't recognize the number on your caller ID. I know sometimes that's hard to do, but answer it. It's probably us calling back with test results. We'll also really want you to give a working number that we can reach you at with the test results. So it's just please consider that when you're giving a number, that it would be a number that you would be available to answer. Maybe it's your cell phone instead of your landline if you work during the day and so forth. So, so with that, I also want to say that we have had lots of questions within the community in regards to youth sports. We have worked hard on that. And this week, we'll be releasing guidance on our website. We'll put a link out to social media and so forth. We have worked on that with Dr. Dawn Mattern. She's the Deputy Health Officer at 1st District Health Unit. And we have had input from state and CDC recommendations. So look forward to that. It will provide not only sports teams, but parents, spectators, all of those involved in sporting events or activities, some tips and guidance. Again, these aren't regulations, but they're guidance for you. And we would strongly encourage you to practice those recommendations. I have to say, since this is our last press conference, thank you very much to the press for being here every week, helping us get our message out. We truly have appreciated that. I also want to congratulate this community on how well they have done in response to this. From a public health perspective, I could not be more proud of our community. You have listened to recommendations, you have worked hard as a community, and I think our numbers are showing that. That doesn't mean that we can let off, but we want to keep those numbers down, and we want to continue to be vigilant. And so please continue all the practice, or all the tips and recommendations that we've given to you over the months now. Who can believe it's been months we've been at this? But social distance, wash your hands, wash your hands, wash your hands. Keep your hands away from your face. Wear masks when you're out in your community. I just feel like I have to say this one more time. It's my last shot. Do all of those things. Avoid high-touch areas, or at least assure that they are being cleaned prior to you using them. So continue to do the outstanding job that you have done, and I just want to thank you so much for the support and the activities that this community has engaged in to assure that it continues to be a healthy, safe place for all individuals. So thank you.
Thank you so much, Lisa. Up next, we have Randy Schwann from Trinity Health.
Thank you. Good afternoon. Just a couple of major topics I want to touch on, and I'll stand for questions. First, as we have talked about here last few weeks, Trinity recently did enact its masking policy. So beginning yesterday, we are requiring all who enter our facilities to wear a cloth face covering and to bring it with you when you come to any of our facilities. So we know that a face covering helps prevent the spread of the virus, especially amongst those of us who may be asymptomatic carriers of the virus and might be spreading it without knowing it. And in order to help keep our staff and other patients safe, we are requiring you to wear a cloth face covering or a mask when you enter our facility. So we intend to provide masks or face coverings as long as we have them available. As you know, they are in short supply for the medical community across the nation, so I would not count on that. I would ask you to be sure that you're going to be able to proceed in our facility by bringing your own face mask. If you can't wear one or you forgot one, you might want to call your provider, see if you can make other arrangements. We do offer telehealth visits as well. And in some of those cases where you are unable to or will not wear a face mask, perhaps a telehealth visit might be appropriate for you. Secondly, visitors. We have, again, starting yesterday, relaxed a little bit our visitor policy to the hospital and clinics. We are allowing one adult, non-symptomatic adult to accompany a patient or to come to the hospital to visit a patient, provided you wear a face mask. So, again, we have to balance the notion that family is important to our patients. We know that. Family is important to help a patient navigate to their clinic location or to their outpatient procedure or to your hospital bed. We acknowledge that and we support that. We know that family is important in a patient's healing and comfort and communication with a medical care team. We also know that, again, visitor restrictions are one of the strategies we've used across the country to slow down or stop the spread of the virus. And so these two policies together go hand in hand. Relaxing visitor restrictions requires the use of face masks. And so with those two conditions, we hope to safely allow family members to be with their loved ones and allow for good communication between the care team and the patient and allow for reducing the spread of the virus within our facility and outside. Finally, on the topic of testing, Trinity Hospital and Trinity's clinics here in Minot are in their second day of a 3-day testing event. We expect to test 500 to 600 people, employees of the hospital and clinics this week. This will be round 2. As you know, 2 weeks ago we conducted round 1 and we tested nearly 500 employees in that event. We also know that Trinity Homes is slated for another round of resident and staff testing next week. That'll be the second time that that facility has gone through that same event, and we'll have another 500 or so tests conducted there next week. 2 weeks ago, as you recall, we conducted those COVID tests along with the cooperation of First District Health Unit, and it resulted in 0 positive cases at our nursing home. So look forward to doing that event as well as this one at the hospital today and tomorrow. I think that's all I have for now. Thank you.
Thank you, Randy. Up next, we have Mark Janser with the City of Minot.
Thank you very much. Good afternoon. Pleased to be here pinch hitting for Mayor Sitma, who is in Grand Forks at the funeral for Officer Holt. So he's there with the Grand Forks mayor and other mayors from around the state at that event. We're very pleased that numbers have remained low. And I think that, as you know, was pointed out by Lisa, that's something that our community can be very proud of. We are then in the process of trying to go back to a little more normalcy, which you will hear more about as the week goes on. I want to make sure everybody's aware that we plan on opening facilities of the city to the public on the 15th of June. As we do that and go back to more like business as usual, we do want people to do all the things that Lisa mentioned that we have discussed over and over again. We will ask people to wear face masks, observe social distancing. We will provide hand sanitizer here and at the other facilities. So that will be starting on June 15th when the facilities will be opened. For city council meetings and so forth, we will still continue to maintain the spacing, the social distancing spacing in the facility, so that may limit to some extent the capacity that we have. But it's very important that we begin to get back to normal. We will continue to offer people the opportunity to comment on our website and to submit questions and so forth to the City Council on matters that are on the agenda and whatever else they have on their minds. So if you're not comfortable coming to a meeting yet, you can certainly avail yourself of that method of communication. So we're trying to move back to the sort of like old way, but with some new normal safeties on as well. Lastly, I'll just touch briefly on an update on the police case. To date, as you remember, we've had 2 confirmed cases within the Minot PD, the entire force. And it's great news that after the mass testing on Friday, those tests were negative. Our most recent positive case in the PD was considered fully recovered now. And so, again, we're trying to go back to, a little bit more like normal. So people are out and about, sun is shining, which is, kind of bad for the virus. And so we get some sun and continue to act responsibly as a North Dakota smart community would want to do. So thank you very much.
Thank you, Mark. Now, on behalf of Ward County, I would like to announce that we will be reopening our doors to the public on June 11th. So a little bit ahead of the city, but we will also be taking all of the precautions similar to what Mark had mentioned. We won't be requiring masking or anything of the like in our building, but they are available upon request to our patrons. And with that, I have one more thing to mention, not on behalf of the county, but one last plug for our hometown heroes. This has been a very trying year, and I know that Visit Minot and the Minot Chamber of Commerce has been working really hard to identify those people that have been working hard in the public to make it a little bit easier for us. So if you have those recommendations for somebody to nominate, please let them know. With that, we will stand for questions. Yes.
I have a question for Mark. Those Minot PD officers, they're both back at work now?
Yes, I believe that is the case. Both officers, I believe, have returned to duty.
Question for, oh, sorry. Go ahead.
It's about the Trinity employees that are furloughed. Do you have to get called back? Do you have a plan for calling them back? And you're advertising positions now, and how does that fit in with the furloughed employees?
So Jill had a question about our furloughed employees and whether or not they've been called back, or do we intend to call them back, and what's the plan for that relative to the notion that we have job openings posted on the website. So thank you for that. I think overall we've had a number of staff either fully furloughed or partially furloughed since the beginning of this. Those who had restricted in hours to some degree or any degree, maybe 4 hours a payday, 8 hours a payday, those partial furloughs numbered around 700 of our team. So the fully furloughed weren't that many. Obviously, there were about 170 of our 3,000 employees who were fully furloughed at one time. Since that time, we have recalled about half of that team to resume the duties that they were originally in. And we've been able to do that because as we have been gradually regaining some volumes and demand in surgeries, in outpatient therapies, in urgent care, and those kinds of things, we've recalled those employees back. We intend to, and we have strong commitment to, continue to do that as soon as possible. So the plan is to have all of those members of our team recalled back to work as soon as possible. Any follow-up question to that?
We're just wondering if you've been staffed adequately during this time.
Yeah.
There's been shortages of nursing
Great question. So we have used our labor pool as a mechanism to fill spots that were either new. In the case of the nursing home, one of the requirements initially was that we no longer feed the residents in a dining room concept, but we pass trays to them individually in the room. It magnifies the amount of staff that we have to do that. And the nursing homes around the state, particularly ours, were not, did not have the labor force to do that adequately under a normal staffing condition. So we did lean on and use those partially furloughed staff initially and fully furloughed staff later to help those kinds of job duties. So while you might have been furloughed, it's very likely I know many were brought back to fulfill some of those temporary, not typically my role kinds of positions. And so as the nursing home, for example, is going through a review at the state level for how to reintegrate back into their normalcy, we expect that some of those things will go away, and we will no longer have to supplement that labor force with furloughed employees. So, yeah, as we can use our own furloughed staff, we have been. Now, sometimes the role that we need to have fulfilled is one that is not represented in the furloughed staff. And that's why you'd see a position for a new member, a recruitment taking place. We're still a growing organization. COVID and the response that we had to do to reduce our surgeries, to reduce our services, to require greater expense on supplies and emergency services, emergency supplies, protective equipment, and so on, required us to do this furloughing strategy. As those services come back online, of course, we'll be recalling that staff. But in the meantime, we're progressing full force, full speed ahead on achieving our strategic plan. And as we do that, we'll need new talent, more talent, to accomplish those directives.
Question for Randy, and then probably follow up on the same subject for Lisa. If Trinity Homes is being tested next week, and hopefully everyone tests negative, the Health and Human Services Director says that visitation might be allowed once again at Trinity Homes. Has the administrators of the home been working on a plan if they test negative to allow visitation of residents?
Absolutely. In fact, our nursing home administrative team has been exploring ways to reintroduce family visits before they were mandated to follow the state guidelines. So we were already progressing towards a plan that would allow us to ease off on some of those restrictions with facility made a glass room for that purpose. They didn't have to use it, I don't believe, but they were ready to deploy that if possible. They sought permission to do that. They've been using electronic means to help families visit their loved ones in the nursing home with iPads and all sorts of other devices. They've been allowing and trying to facilitate visitation from outside to inside folks. We've seen some of those postings on social media, very heartwarming stories of families connecting with their loved ones in the nursing home. So we are on the front end of wanting that to happen. So as soon as we get the green light to do that in a way that remains safe for the residents, we will deploy those strategies to make sure that happens.
Have they given you any indication of how long after your negative test? I mean, they said that was the first criteria, was negative testing and good-looking numbers within the community, both of which presumably, hopefully we would have.
Right.
Have they given you an indication as to when you can begin implementing those new visitations?
I've not been in those conversations with the task force to understand their timeline, but our nursing home, as well as other nursing homes across the state, will take their guidance and employ those things that they require before they can once again open for some limited visitations. And as I said, I think we'll be on the front end of that, hopefully, and poised to do that as fast as possible.
then a follow-up for Lisa on this subject.
You?
Lisa, do we know if there are other nursing homes in the area that are also being tested at this time?
Yes, there are several nursing homes. And I don't have that list in front of me, but I think I can be confident in saying that throughout the 7 counties, most nursing homes are being tested on a fairly regular schedule. So the state goes in and does most of those testing events.
Yeah, they had announced last week that the staff and the residents had to be all tested for a second time before these visitation restrictions would be lifted. And I know that it's very important to the families to be able to see those loved ones. So we're paying close attention to that second round of testing so that we can give the good news. So if we could get, confirmation that there has been a second round at these places, I think that would be really helpful to the public.
I think that I can get that information to you, or we can post it or make it available somehow. It is an ongoing process, so it's throughout the district. The other thing I neglected to mention earlier in my comments was we did test up in Burke and Renville County, and those tests were geared towards emergency responders. We are also planning events for up in Bottineau. McLean is working on an event in the Garrison area. There has been testing in Sheraton County at McCluskey. There will be testing in Turtle Lake. So it is continuing throughout the 7 counties. And I think the important thing for the public to remember is, first of all, the guidance that is coming out. Individual entities will still be looking at that guidance and making the best decisions for their unique situations, whatever that may be. So for the most part, that's guidance that they use and guidance that we provide too. But we understand that everybody has different situations within their businesses, communities that they're working with, and they will hopefully take that guidance and use it as a reference in their decision-making. The other thing too is, even though it is feeling like we are on a downhill slide, because things are opening up, we are still going to be very, very vigilant. And the governor talks about these rapid response teams, and that's exactly what's happening here, is we are watching the community when we see any potential threat or a possible cluster. We're going to move in quickly, do testing, and respond back to that testing. So that is where we will be focusing most of our efforts this summer, as well as gearing up for next fall in preparation for vaccine that may become available late in 2020. And we anticipate a robust flu vaccination season too. So those are some of the other events that are happening that are somewhat related to COVID here. So thank you.
I have a couple more for you.
Okay.
On the follow-up testing with the LEOs, with the law enforcement and the, I was a little unclear of your breakdown. Were they all negative? Or
Yes.
All of them, all that follow-up testing was negative? Fantastic.
All the testing that we did last Friday
Right.
was negative.
With
Yes.
the law enforcement
Yep.
and the inmates and
Yep.
everything.
Staff was contacting all of those people this weekend. Shout out to Roxanne. She was doing a lot of those calls, and they all received their results. We just had a handful left to come in yesterday morning, and those came in.
Great. So will you be able to report out the results of tomorrow's mass testing event then?
That will come as individual results, not as a group result. So I'm not exactly sure how we're going to get that information yet.
And then I had a completely unrelated question to that.
Okay?
I don't know if you have this data or can get it. The last time we did the mass testing event and then had the false positives, there were still 7 that were left over that remained positive. And when they tested positive, they were all asymptomatic. And that brings up the question with your contact tracers who follow up with these people. Of all the asymptomatic people who were asymptomatic when they tested positive, how many go on to develop symptoms?
I don't have that information. I'm sure somebody in the state epidemiology office does have that because all of the contact tracing data is entered into the state epidemiology database. So, yes.
All right, we'll follow up there. Thank you.
Thank you.
All right, one more pass. Any more questions that we can answer for you? All right, thank you all so much for bearing with us for these past few weeks.